Am I sharing? Yep.
You are, yes.
Yeah.
Cute.
Yeah.
Just let me go to into slideshow. Okay, right, so my name's Angela Wright, as Lee said. My role is Assistant Director for Place Development and Delivery at Derby and Derbyshire ICB. And today we're going to discuss Place, which is one of the major programmes of Joined Up Care Derbyshire. So Place, what is it? Well, it's a way of organising ourselves, and you can see from the map that we are organised into 8 place areas. These are roughly coterminous with council boundaries. Organising ourselves like this, though, means, of course, there's variation in terms of physical size of places, in terms of the population size. So probably in South Derbyshire, the way the NHS counts population's about 60,000. The biggest is Derby City, which is more like 340,000. It means there's variation in the type of environment, urban, rural. It means there's variation in the type of population as well. Derby City has a very young population, for example, compared to the rest of the places. So there's lots of variation between the places. So we have to try and run the programme in a way that meets each individual's population needs. Place is also a way of doing things. So I put 3 key points down there that I think is are hallmarks of the way that Place does things. You could say it's a way of doing things differently compared to how things have been done for a number of years. So we think the 3 characteristics of place working are partnership, everyone is equal, the relationship is the most important factor. It's the driver of what we do in place. I think in the past, too often, we've probably allowed contracts to direct how services are delivered, and that's quite often been at the patient's expense. Contracts, of course, are important, but they should underpin the way providers have agreed to work together. For the population to get the best deal from us, providers do need to work together. And we expect providers at a local level to collaborate and not compete with each other, which again is a different culture to one that we've been used to. We also believe in a learning and innovative culture. We like to try things and see if they work. If they don't, we learn and move on. If providers work to a specification that's too detailed on how services should be delivered, it can stifle innovation and improvement. So we try not to work in that way, and we have forums that are set up specifically for sharing and learning between different places. And finally, empowering local teams. We set out a framework to ensure there's some consistency across the county in what we're trying to achieve and what it is that we want places to do. But we leave it to local teams to decide how they do that and how they deliver and how they achieve the aims. If you try to do everything centrally, you're sort of constrained by the capacity of that central team. But if you create the environment, the right environment, and empower others to deliver, then you can achieve an awful lot more. But essentially, Place is about joint working between staff from different organisations and joint working between staff and communities that they serve. So why is Place important? Why do it? Well, our health is only 15, well, we want to improve the health of the Derbyshire population, but our health is only 15% related to the NHS care we receive. Other factors have a lot greater influence on our health. Our housing, the quality of our housing, whether we live in an urban or a rural environment, what job we have, lifestyle factors like how much alcohol we drink, what's our diet like, how much exercise we do we smoke, and we also want our we want to be able to provide an effective and efficient service. But even just if we think about the NHS, staff work for many different organisations. And then you've got other statutory organisations like local councils, social care, and non-statutory bodies too. So how do we ensure that our population receives coordinated care, and that all the resources that we have in Derbyshire, how do we ensure that we're using them efficiently? So what we've got is a series of partnership structures. They involve all local service managers within a place, and they provide forums for communication, coordination and transformation. What we're doing is we're bringing together the people that are responsible for delivering care and support to the local population with those responsible for the factors that affect our health that I was mentioning on the previous slide, such as housing, the environment, lifestyle factors. So these forums will involve representatives from primary care, community care, social care, VCSE sector, public health, local councils. And these forums aim to work together to better coordinate services, to identify local population needs and work together to meet them, to break down organisational barriers and provide a better experience for staff and patients and improve local population health. So I'm going to pause there, and because, as mentioned earlier, I'm joined by some colleagues who are going to tell you about some place work that demonstrates the added value that this way of working can bring. So let me stop sharing. So I'd like to introduce Emma Plummer, who's the Amber Valley Place Manager, and then James Cook, who's going to talk about Chesterfield, that's some of the work that's happening in Chesterfield, supporting the population of Bower Hill, and then Emma Beeston from Derbyshire Carers Host Association. So if I hand over to Emma Plummer first.
Thank you, Angela. So like Angela says, I'm Emma Plummer. I'm the Amber Valley Place Alliance manager. So I just wanted to share an example of some of the work that we've been doing in Amber Valley, and hopefully it will just kind of bring some of the things that Angela's been talking about to life a little bit. So this example relates to services for children. So what our partners have done in Amber Valley is to use some of our better care funding to earmark a budget that can be used to support children and families. So Derbyshire County Council and the Children's Services have worked together to agree a new pathway of support for children and families who may need a small amount of funding to purchase a piece of equipment or to do something that helps to keep their family, their home environment safe, and to reduce accidents and to reduce referrals into statutory services. So the amount of money that was allocated to this work was approximately £30,000, which sounds like a lot, but out of the whole Better Care funding allocation, it's quite a small amount of money, but the number of families that this supported has been quite far-reaching, with over 200 families within Amber Valley being supported by this funding. So what Derbyshire County Council and Amber Valley Borough Council agreed to do was to earmark this funding for discretionary allocation where a family may need something to support the safe environment of their family and their household. So the average spend that was allocated was about £200, and the criteria for accessing this funding was related to increasing the safety of children in the home environment, reducing accidents and admissions to hospital, reduction in fire and improving fire safety, a prevention of or a delay of a referral to health services or social care services, and also to prevent eviction from people's accommodation and homes. So that was the referral criteria, and referrals all came from either the council or the children's services. So that was what the money was used for. So it's a local pathway based on local partnership working in line with the principles that Angela's already talked about. So I just want to share a couple of examples of what the funding was used for and how it's been used to benefit families in Amber Valley. So there was one case, a child was sleeping on the floor on a mattress with their parents, and this child, he really wanted his own bed, so the funding was able to buy a bed for the child, which he was super excited about and was telling everybody at school, his key worker, all of his friends and family. And also the funding also paid for a carpet for that room because they didn't have a carpet, which improved the insulation for that room, and obviously the child had a comfortable bed to ensure optimum sleep and sleep health. So that was one example. Another example where a family didn't have a set of wardrobes or drawers for their children. So that meant that all of their clothes were just in piles on the floor, scattered around the floor. It was quite a mess. It was a bit of a fire hazard, really, and a safety hazard in terms of tripping over things and falls, etc. So the funding paid for some drawers and a wardrobe for that family, so they're able to safely store away their clothes, reduce the risk of accidents. They've now got a much nicer environment to live in, and also that funding purchased a cooker as well. The cooker that they had was quite old. It wasn't as safe. It was an older model, and so they were able to buy a new cooker, which improved the safety of their cooking for family meals. Another thing was to fund a skip, bit of an odd thing really, but then you think about people who don't have access to a car, don't have the funds to kind of pay somebody to take away their clutter and rubbish. So the funding was used for a skip to, again, reduce things that are not needed in the home, reduce the accident risk, reduce fire risk, and make their home a more kind of organised and appealing place to live. So there are a couple of examples. So this work it continues. It's just a great example of partnership working and how this kind of discretionary way of using the funding can support children and families in Amber Valley. So thank you.
Thanks, Emma. James, are you okay to go next?
Oh, yeah, thank you, Angela. So my name's James Cook. I work with an organisation called Active Derby. I'm connected into the Chesterfield Place Alliance. So I just want to share, I guess, some of the work that's been happening locally connected to Barrow Hill, one of our communities in Chesterfield. And so there's three elements I'll share. I'll just touch on the local Place Alliance and the work they've been doing, how that's helped us to focus into Barrow Hill, and then just a little bit around what we're learning about ways of working and how that's been really important. And so for me, I really value the opportunity of being part of the local Place Alliance and it bringing together a whole host of different organisations and just enabling that bit of us working across service, organisational sector boundaries to come together and really spend time thinking about, well, what's the work that's important to us all and how does that influence the work of us as a Place Alliance. And we're all really interested in how we get closer to people in communities and how we bring some of that lived experience into our work to help inform decision making, service design, and so on and so forth. And it's really helped us to develop and think about, well, as a Place Alliance and as a wider Chesterfield partnership, what's our place-based approach to addressing inequalities and how do we really think about where are some of those places where we might want to spend more of our time and focus our efforts, and as part of that bringing the data together, looking at where greater health inequalities exist, we've created a bit of a narrative to think around, well, how do we start to bring that lived experience into the work and what are the parts that will really help us? And we're testing this approach, and Barrow Hill that I mentioned is one of those communities, certainly not the only one when we look at the data and look at areas of greater health inequality, but an area as a Place Alliance where we wanted to use as a bit of a test. And one of the reasons for that is that we are working to develop a health hub in the Memorial Hall, which we're hoping will open in January next year. So it's given us a bit of a focus and something to come together around, which has been really helpful. And just worth mentioning that part, I think it is about testing and learning this approach as we go. We don't know what will work in terms of trying to address health inequalities, but it feels like that togetherness from a Place Alliance perspective of wanting to learn about that, and then through Barrow Hill building some more local networks where we can get more into the detail and understand what are some of those challenges locally. So part of that has been around we're learning about how do we create more authentic ongoing conversations, and some of those factors that Angela mentioned earlier on, just understanding about people's environment and where they live, their housing, employment, access to green space, all of these different things, these different factors we know impact upon health. So how do we start to really understand some of these different things that are going on in people's lives? The other bit that we're really finding is the importance of connecting that lived experience into organisations and networks, and locally, how do we come together as services, organisations, networks, and work with residents to co-design what some of this work is and the solutions around that. And I guess just as an example around the Memorial Hall, we've got a group of mostly NHS partners that might come together around the service spec of what might need to go into the Memorial Hall based on the services that we want to deliver. A lot of that goes completely over my head, but very interested in it. It's great because there's an opportunity to connect resident voice into that. We've got a group which is proud to be Barrow Hill, a lot of community members and groups that are part of that particular network, and so bringing those two together to help create a conversation where we're using data and lived experience to inform what services in that Memorial Hall might look like. And we're also working with a community organisation, Barrow Hill Community Trust and Community Growth, organisations that have got trusted relationships in that community that can really help us to have some of those conversations. And there's a real thought from a Barrow Hill and a Place Alliance perspective is it's one thing being able to create these conversations and bring this lived experience together. From a Place Alliance perspective, we're now thinking, well, how do we collate, capture and organise all of that insight? And then how do you create the mechanisms to connect that insight to relevant parts of the system so it can start to inform future action and decision making, and being a pilot area around the insight framework is helping us with our thinking around that. And so there's lots of great networks and organisations and individuals coming together around that Barrow Hill work, and just zooming back out, it's really helping us to think about, well, how do we work as a collective? And it feels really important to spend time thinking, how do we work differently, and what does having a bit of a different focus on how we work look and feel like? And it does feel quite different. I think Angela mentioned relationships earlier. There's so much time spent on relationships and thinking about those connections, helping us to think about how we all come together around similar pieces of work and the roles we can all play within those. So that relationships, collaboration coming out. I think there's also something about having really open, honest relationships, and us not thinking like we need to have the answers. We're all exploring and learning this together, and creating those conversations feels really valuable. And the final bit that I'll touch on, we keep coming back to a conversation around scale versus nuance, and perhaps an example around that. We had the Place Alliance meeting yesterday. We're having a conversation around a place-based approach to CBD. And actually, across Chesterfield, that feels like a really difficult thing to get your head around, and thinking, how do we get our heads around the approach to CBD? But then when we start to take more of a place-based approach and think around Barrow Hill as a community, having that much smaller proportion of the population that we can start thinking around, what are the connections, what's going on in that community, what's going on in people's lives, helps us to think around well, yeah, as PCNs, as GPs, as deliverers of different services, how can we start to have a conversation with that community in a different way that really helps us think around what an approach to CBD could look like, learning from that for Barrow Hill. But then as we scale that back up, I think learning for us as a Place Alliance to think, well, what could this look like more broadly across Chesterfield? Yeah, and I think that's it for me.
That was great, James. Thank you so much. That's given me a quite good segue into some other things that I'm going to say later on as well. So fantastic. Emma.
Hi, can everyone see and hear me? Hello, so I'm Emma Beeston from Derbyshire Carers Association, and last year we were given commission and funding from the High Peak Place Alliance to do a research project and consultation project with carers in the High Peak and Glossop area, with carers having been identified as a priority for the High Peak Place Alliance. Our consultation project sought to do two key things. Firstly, to understand what the realities and particular challenges are of being a carer in the High Peak. Are they unique and different from those faced by carers in the rest of Derbyshire and indeed the rest of the country? And then secondly, to make recommendations for future service provision on the basis of carer feedback, to hear from them, what do they want future support to look like, what is most helpful to them. And early on in this project, we identified key barriers to carer engagement. Most crucially, perhaps a concern about, will anything change? Is there any point in participating? Will our voices really be heard? And also concern around the perceived retreat behind the computer screen of services, and that they might be forced to engage with digital platforms in order to participate, which was a barrier for many carers. To further understand the challenges that carers face around the increasing digitalisation of care, we partnered with Rural Action Derbyshire in order to do some digital mapping of the area and across Derbyshire. And in order to answer this concern about will anything change, we operated on a you said we did and also a you said we will model, so that carers could see where their feedback was being taken forward to implement service change. Carers told us many things. They told us that over 44% of carers in the High Peak are caring for over 100 hours a week, that 41% don't feel there is effective communication between services, that 65% feel uninformed about what services and support are available for carers. And yet, despite this, 84% of adult carers and 100% of young carers who were surveyed were happy to continue caring. Carers weren't asking to be relieved of their caring responsibilities, but to be better and more effectively supported by services to be able to care well and to preserve their own well-being and health whilst doing so. And whilst that's valuable information, the key question, I suppose, for many listening today would be, why do carers matter? Why is this a paramount group of importance to the wider sector? And I might posit, in line with the place's priorities, that caring nationally is of equivalent value to a second NHS. And that is only looking from a societal level. It is in society's interests to support carers and allow them to continue to perform the valuable work they provide. But also, so many of us will care at some point in our life. Estimates range from 25% to 50% of the population are likely to face caring responsibilities at some point. If I highlighted every area that carers in the High Peak who participated had raised as a particular focus for challenge, then I'd be talking for the whole hour and everybody would be sick of hearing from me. But I'd like to show a few of the ways that we have responded to key concerns that carers have talked about. One, the importance of their relationship with their general practice surgery as the key place of contact for many carers with health and social care services, and for many the point of diagnosis for the loved one that they support. In response to the paramount importance of this relationship, Derbyshire Carers Association has introduced a GP liaison worker. This was started in the High Peak on the basis of this in-depth study, and will now be expanded across Derbyshire to work with general practice teams so that they can think proactively about how they can support carers and how they can incorporate carers into their methodology and practice. Secondly, carers highlighted distance. the anxiety that too many things are focused on more populous parts of Derbyshire and that the High Peak gets forgotten about. And linked in with this, the effectiveness of communication between services. Where support is available, there is not sufficient planning between services to ensure that carers aren't forced to choose between different offers of support. Derbyshire Carers Association ourselves have been guilty of this, and on the basis of carers' feedback, we've been able to move the timing of our Glossop support group for carers so that it no longer clashes with another organisation's group to support the cared for. Very much taking on board the value of the place aim to improve communication and learning between services. We also introduced information roadshows to give carers a multitude of opportunities that didn't involve long distance travelling to find out about what support was available to them earlier on their caring journey. And we made sure that these were in-person opportunities to remove digital connectedness as a barrier to support. Where carers raised issues that were beyond Derbyshire Carers Association's own remit, our own ability to affect change, we've partnered with other organisations in the spirit of place working, including Healthwatch, Time Swap and Rural Action Derbyshire. Crucially, we will not stop here. The end of the consultation project in High Peak does not mark the end of carers as a priority, either for Derbyshire Carers Association or for the Place Alliance. Within Derbyshire Carers Association, we have expanded our consultation and co-production work, not only with a focused project in South Derbyshire, but also with a permanent co-production and consultation worker who will operate cross-county, and we will be running whole Derbyshire-wide consultation panels on areas of key issue and concern for carers. In High Peak itself, our new carer engagement worker will be planning a programme of social connectedness meetings that will offer carers the opportunity not only to upskill and improve confidence on digital platforms, but to socialise and have a nice time while they're doing it, so that it can be a social opportunity as well. Thank you.
Thanks, Emma. That's great. Thank you to both Emmas and James. That was just a smattering of examples. Each place could give you a long list of the added value it's brought to working in this way, but hopefully that's shown you how bringing together, just a few examples about bringing together agencies to make a practical positive difference in people's lives, about agencies coordinating to respond to the needs of specific populations and using specific feedback to amend how services and support are provided. They were great examples. Thank you, everybody. Just going to re-share my screen. Right, so how long have we been working in this way? We've been working in this way for the last 6 years, since 2018. And through the time, we've noticed a number of stages in development. So as you probably got from some of those examples, when you bring everybody that's involved in providing services or care or support into a local area together, the first thing they do is find out what each other is doing. So you develop shared understanding of that, establish the relationship, you build trust in other in the services and the support that other manager is delivering, and then you move then quite quickly into a phase of coordination. So we saw this really in the pandemic, is at no point did everybody need to think, anybody ever need to say, oh, well, I need to find out who the person is in the council that I need to ring up that deals with that, or how do I communicate that to all the nursing and therapy staff in my area. People already knew who to get in touch with, and people just picked up the phone and just got on with responding to the needs at that time. And then also we've seen people start doing joint projects together, like some of the examples that we've said. But then we've, over the last sort of about 3 years ago, we started to notice another phase, which is people thinking we can do this better, actually, a transformation phase. We can do this better, let's change it. And this is a really exciting phase of what we're doing. So the types of, the main type of transformation that have been managed through Place at the moment is the Team Up programme. This is actually the subject of the next Derbyshire Dialogue. There's lots of different aspects to this programme, so I'm not going to go through it all now. Essentially, though, it's encouraging the joining up of existing services so that they work in a more coordinated way around the patient, hence being called Team Up. We've been working primarily with the housebound population, and we found it's brought tremendous benefits to them in reducing unnecessary visits to hospital. Staff find it very rewarding because they feel they're making a positive difference. They can see that they're using resources more efficiently and effectively as well. Team Up embodies the characteristics of Place that I talked about at the start. It's about working in partnership. The relationship is the driver. You can't team up and work with other services if you don't understand what they're doing and trust what it is that they're doing and have that relationship. There's lots of the learning and innovation, all the time looking about how we can do this better, how can we improve it, and learning and sharing that as we go, and empowering local teams. We leave teams to decide themselves how to deliver in a way that makes sense for their local population, using their local resources. So it's set out what they need to do, but the how is for them to decide. But Team Up is a medium to long-term transformation programme. It's a huge change in how services are delivered, but it will bring huge benefits already, but need to keep going so we can harness the potential of those benefits. Another very live conversation that's happening in places at the moment, and James alluded to it really, is about tackling health inequalities. Places know their populations really well. They know their areas of deprivation, they know what the needs are. And so we're starting to develop an approach to meeting these, but that needs system support. We often do we might do an initiative to tackle smoking, we might do an initiative, say, to tackle circulatory disease, for example, but these elements need to come together in a local community because it's often the same population you would be targeting for these different initiatives. So as a system, we might need to find a way of planning them individually and meeting the various aims of different programmes, but also we need to deliver them in a way where it makes sense for the local community. So how can you help? So the biggest thing everybody could do is start to think system instead of organisation. If you're people don't have, and if you're an organisation that treats patients or you have clients, you don't have a monopoly on those. They are probably going to be somebody else's patients or clients too. So be thinking, is the way that you deliver your care or support assisting someone else in a different organisation who also wants to do their absolute best for that person? Thinking about, are the rules of your organisation helping partnership working, or do they make it more difficult for people from different organisations to work together? And if you don't know, find out. Do you work in an enabler function? Are you working in finance, contracting, HR, governance, estates? Are you thinking system as well as organisation? Are your rules of your organisation that will have been put in place for really good reasons, quite often to manage risk, but are they helping partnership working, or are they a barrier? If you want to make decisions, if we want to make decisions as a system that's optimal for the system, that quite often means it's not going to be optimal for every organisation or every partner involved. So we need to make sure that we're thinking and planning on that basis. Are you facilitating collaborative and partnership working? And if you're not, then why not? because that's what an integrated care system is supposed to be doing. That's why it's different from the way that we've been working before. If you have the power, then change it. If you don't have the power to change it, raise it with your line manager. And if they can't, ask them to raise it with their line manager. All the main statutory organisations in Derbyshire are involved in place and are committed to this concept. You could also engage with your local place partnership. If you're a community member, we want, as the examples have shown, we want to respond to local need and try to improve things that matter to people. If you're from a non-statutory organisations, these organisations play a vital role engaging both with communities and with statutory organisations like the NHS and councils. So we can all enable joint working. We're supposed to be working together, aren't we, for the benefit of our population and our patients. But if how we're working at the moment is not benefiting our population and our patients, because we're all working against each other in our own organisations, then we need to change it, don't we? So I hope that's been some helpful explanation regarding what the PLACE programme is, what it's about, why it's important, and I'm happy to answer any questions or provide any further information.
Excellent, thank you very much, Angela, and co-presenters. That was really useful. Some good examples there and a good overview as well. There have been some comments in the chat that have helpfully been answered, and lovely to see some offers as well in the chat. Thank you there, Carol. I can see Emma's picked that up. So I'm going to come on to Ken's question about how does PLACE interface with GP practices, and are there specific design aspects you'd need to consider for each practice?
Thanks, Ken, for that. So GP practices are organised into primary care networks, and each of those primary care networks has a clinical director, and those clinical directors are members of each local PLACE alliance. So that's how we sort of feed in the sort of views and the need of practices into these forums for discussion.
It's just, yeah, if I can just ask, so it's done at PCN level rather than our practice saying, hey, we've got a specific issue with, I don't know, I'll make something up, with the elderly within, who aren't in homes and things, who are living in, you know, who put certain demands on us. How can the practice then interface with key organisations to help support them? It's just, I'm thinking, you know, are there specifics that could affect the way you do, or do they have to go back through the PCN?
Well, we wouldn't discourage a practice from most practices should know who their local PLACE manager is, or who their local public health rep is, or who they might need to contact around community services. But so we're not discouraging that. But they're happy to use their PCN to raise needs as well. That would be fine. Yeah, so either is fine.
Thank you.
Thanks, and thanks for the question there, Ken. I can't see any hands raised, but I can just see things coming into the chat where Richard's just adding in that reps from GPs also attend local PLACE alliance meetings, including the one in Erewash. I can see hands coming from Ruth, if I bring you in.
Thank you very much, and I'm sorry I'm a bit late. I was actually talking to a carer who just didn't know where anything was, or I'm up in High Peak. So unfortunately, we are seeing a lot of reorganisation around a lot of our services at the moment, and it's probably the same across Derbyshire. The short breaks for young people, the day centres, it's really difficult for people who feel they've not got anything already then to find out about things at the point that they're closing down, which is often when they do find out about it. Is there some support for carers in particular who are going through this and just don't know where to turn to, or what if they have felt there's not much available already, it looks as if they're going to be in a more difficult situation? So is there some support around that, please?
Emma, do you want to? Yeah, Emma's going to come and answer that.
Hi, Ruth. So at the personal level, I'd really encourage anybody who's looking for more support as a carer to reach out to Derbyshire Carers Association, which is now also operating under the banner of the Derbyshire All Age Carer Support Service. I can pop my email in the chat if you'd like to sort of get in touch with me as a first point of call. I absolutely don't want to sort of deny the fact that more needs to be done to support carers and the high peak in many of the ways that have been highlighted through our consultation last year, supported by the place. It can be particularly vulnerable because they are in that quite liminal position, sort of on the border, and you can be so far from so many of the centrally based support services. But absolutely, we are working ourselves and with other partners to try and put more support in place where possible, and absolutely with regards to the individual you've been speaking about, if you want to get in touch, and we can sort of look to put some more support in place for them as well.
Excellent, thank you, and cheers for that, Emma. Jo, if I bring you in next.
Hello there, I am the manager of the service that does the statutory requirement for unpaid carers in Derby City, Universal Services for Carers. I'm just wondering if there is initiatives within Derby Cities. It's obviously been all county and very, very interesting. I'd really be interested to know if there is some link up actually in the city and where we might get in for that link up. Is that based in GP surgeries as discussed, or is it in a wider context? Thank you.
Hiya, Jo. Obviously, Derby City is supported by Universal Services for Carers rather than by Derbyshire Carers Association. However, absolutely, we're looking to increase partnership working, and I know that drive comes from Universal Services as well. With regards to
what I was asked, sorry Emma, what I was asking, because I am the manager of that service. What I'm asking is are there any place partnerships within the city that our service can tap into to make things a bit more joined up? Maybe I didn't make myself very clear, sorry.
Right, okay, yeah, so there is so there's a Derby City Place Partnership Board, and in my team I have a Derby City Place manager, and I will put her email address in the chat, Jo, and so feel free to contact her and she will be able to point you in the right direction as to where's the best forum to link in with.
Thank you. Apologies for not making myself clear to start with.
No worries, brilliant, thank you, and nice to get that linked up. So I can just see, just come into the chat now, a question from Pete. Since the inception of integrated care, have you seen any change for the better in terms of an adoption of the collaborative working between those providing healthcare at place level? If so, can you give any examples that illustrate collaboration instead of organisation thinking is taking off?
Yes, is the short answer. So the Team Up programme that I was explaining, that is about trying to integrate care, and we've seen quite a bit of impact in that already. So we've seen, because we're trying to better meet people's needs, the housebound population at home, we've already seen a reduction in attendances at A&E for elderly people. We have it's really helped GP resilience throughout the winter, because these teams working are supporting primary care and linking in with primary care in a way that they didn't before. We are seeing lots of benefits in terms of patient and staff satisfaction. We're seeing, where there's part of the programme that is working about integration between community services and adult social care teams, and we've got tons of examples whereby instead of sort of referring between services, they're just ringing up the manager that they now know and agreeing how best to support that person, what equipment to provide them between them, and quite often what is ended up being what they're able then to respond to that person's need in a much more quickly, because it's not gone through a sort of elongated referral process. It's just been a quick phone call, and they're able to provide equipment or support either on the day or the next day or whatever, whereas somebody would have had to wait for it. So there's loads of examples that we've got whereby having established that relationship, people are then working much better together in a way that's both benefiting the person themselves, but is also, as I said, using our resources more effectively as well, more efficiently.
Yeah, that sounds really encouraging. Thanks, Angela.
Thank you.
Cheers, and thanks for the question, Peter. And yes, as Angela says, we've got our next Derbyshire Dialogue session is on Team Up, so that's all about collaborative working, and I'm sure we'll have some good examples in that presentation too. John, can I bring you in?
Yes, this is something you know about, Lee. This is the network of patient participation groups that is available all over the county. The only problem is, at the moment, at the last count, we only had about a third of the surgeries who'd actually responded in terms of putting forward, you know, a member who would be part of such a network, so that we can all be in contact with one another. This, I think, is a great shame at the moment, but in terms of, obviously, surgeries have to opt in. But really, in a number of instances, to have that ability to share information across the county between surgeries, I think is extremely valuable. And I think anything anybody can do in relation to their own surgery to encourage this, you could ask, do their patient participation groups link in to it? Because it's the patient participation group network that is actually providing this facility. But if the surgeries don't actually identify someone to be a nominated person in that network, we can't do any more, you know, in terms of taking it forward. So individually, anybody here could contact their surgery and say, does your patient participation group actively link in to that network? And Lee knows the background to all this too. Yes,
Certainly. And I'll drop my email in the chat, because if anyone would like to join that group, I'm currently helping to facilitate it whilst a colleague's on maternity leave. So we're supplementing that group where members of patient participation groups across the county get together to network and collaborate with a digital space that they can join, and that's with me to kind of launch, and we're just in the process of that. But yeah, if anyone's interested in joining that, then I'll pop my email in the chat.
Thanks, Lee.
Thank you. Okay, I'm just trying to catch up on the chat box. And thank you very much, Angela, for that offer. I think that's John's hands from before. Just going back to one point that was covered to a point, I think, by Emma, but it was about some of the examples that we had and how people became aware for example, the young gentleman that managed to get a bed. I'm assuming that those are kind of referral. It's almost a referral basis through the links in with the schools and children teams and things like that. So it's not necessarily. I'm guessing there's not a public resource that we can kind of point towards that there is information about this initiative on, or maybe there is. I don't know.
I'll find out exactly what information is available, but as you say, most of the it's via the local children's partnership, so it will be all the membership of that, where professionals and partners understand the referral process and can refer in, and then those referrals will be assessed by the team at the council and the children's services teams.
Fantastic, thank you very much. And we can include those in the notes that we circulate around after the session. So that'll be fantastic, thank you, and help answer that. Okay, so Richard, is that hand up I can see? You are on mute, Richard, so I can't hear you.
Right, you can hear
go.
me now.
Yes.
Okay, on the beds and the flooring, there are two charities, I'm trying to think of their name, that supply bedding, brand new beds, which they've acquired by donations from bedding manufacturers. And they do supply beds and deliver them and install them. And there's a big argument about flooring as well. People who leave premises are encouraged to leave flooring down, not take them up. I've been in a couple of houses over my lifetime where they've taken everything, including the flooring. It's a little bit off-putting when you walk in somewhere and you've got floorboards on your first day. I believe there's a charity that deals with that as well. So I can't give you the names, but I know the bedding one, it does exist.
Oh, excellent, thank you. And if you can think of that, or if anyone else on the call that knows that, feel free to share that. And again, we'll
it's definitely because it's been on TV a few times about them delivering beds to people's houses. So actually my question was going to be about the population. We seem to be talking about, I think the word is indigenous population, the population that exists because we were born here or were settled here. We are permanently resident here, but there are thousands of people who are resettled here because of conflicts, Ukrainians. Are they included in all this wondrous plan?
Yes, of course.
They're hosted, aren't they? They've got no real rights. And they are, I could host somebody, but they don't have any rights.
Yes. Anybody that is settled in Derbyshire, I think the council should know about them, and they liaise with other agencies. So like GP practices, there's usually like a local GP practice that will that sort of works with the council to provide support, and as has been mentioned before, if any wider support is needed by that practice or the council from any other the place partners, then they'll be able to access that via their connections that they've made in their place. Yeah,
there's an awful lot of them end up on the street, even in Derby, because they of one relationship or problem with another with their original host, and then they become homeless. So that, I presume, is another problem altogether, because they fall out of the structured organisation that you're talking about.
Yes, well,
and become part of something else.
Yes, well, the NHS has a responsibility to provide care to everybody, including those that are homeless. So we do, you know, in the there'll be links through between the places and other the charities or the organisations that are aware of those people and will support them. So to try and meet their needs as best we can. So they're not, no one's excluded.
Right.
Excellent. Thank you very much. Now, I'm going to have to bring the session to an end now. It's 2 o'clock, and thank you very much to our BSL interpreters as well. I know that's a very taxing job. So thank you for everybody that's attended the session today. Thank you, Angela. Thank you all the other presenters that came along. Thanks to those that contributed and the conversations in the chat. We will kind of collate this and send an email around after the event. There'll be a recording that's linked and published online, and we can take any individual conversations offline and follow those up. Thanks very much. Our next session is on the Team Up initiative, again, which is all about collaborative working, so leads on nicely from today. And Rupali is going to put something in the chat about the where you can find the next session. Thank you very much and have a good afternoon.
Thank
Thanks,
you. Bye-bye.
everyone. Thank you. Bye.
Bye.